Yeah, just a quick review of the Bodyprox knee compression sleeve. So this is a sleeve is specifically made for people that have knee pain or knee problems. The idea here is that you put the sleeve on, it supports the joint and the surrounding soft tissues, restricts the motion a little bit, so that way the knee has a chance to rest, recover, and not get so stressed out as you're doing things, especially if you're like playing sports or you have a busy day doing gardening or something like that. So a few points about this particular brace. It does have a blend of nylon, spandex, and latex. So I really like that it has nylon in it because nylon's a very durable fabric. So nylon means it'll probably wear pretty well over time. The other thing I do like about this, it has these non-slip silicone strips inside. There's a lot of problems with these kind of sleeves falling down, but they put these silicone strips inside of part here, and so it's very less prone to slipping down. So yeah, braces are good. They do help with pain. If you have a chronic condition, there are some other things that you can do. Because a lot of times if you have a chronic condition, like say knee arthritis, or you've had surgery and you just never really recovered that well, there are other things you can do besides put a brace on. As an example, bulletproof your knee is where I'm getting this stuff from. One thing you'll definitely want to do is you want to strengthen your quadriceps muscle. That's the big muscle on the top of your leg. Interestingly, this whole chapter is dedicated to naming knee problems and the fact that in research showing that if you have this problem, research is showing you probably have a problem with your quadriceps muscle. So for instance, knee swelling, if there's enough knee swelling, it actually kind of shuts down the quads. There's actually studies where they injected people's knees with enough fluid in it and the quads just shuts down. They can't do the straight leg raise anymore. So if you have knee swelling, it can definitely affect your quadriceps muscle. If you have a history of knee injury, surgery, fractures, ligament problems. So a lot of studies, if you have a problem with your anterior cruciate ligament, you probably have a quadriceps problem. Same thing with the posterior cruciate ligament, medial collateral ligament, knee pain. Knee pain can also help shut down the quads too. Sometimes it doesn't really shut them down, but it's just they don't contract properly like they should. So the muscles are smaller than normal when they do things like MRI or they do CT scans or look at cross-sectional area. Knee arthritis, definitely have knee arthritis. You probably need to get your quadriceps strong. A lot of studies showing that if you just strengthen your quadriceps muscle, it actually can help decrease the progression of knee arthritis. So a lot of reasons to definitely keep your quads strong. Other things you can do, fine-tune control over your knee. Here they're talking about things like your hip. Their hip muscle, your hip abductors. A lot of times knee problems are caused by not really anything going on at the knee, but because of the hip. So if you have weakness in some of the hip abductors, for instance, you could have a problem at your knee, causing your knee pain. For instance, people with iliotibial band syndrome, what the research is finding that they have weak hip abductors. And likewise, there's some randomized controlled trials showing that if you go ahead and you strengthen the hip abductors, iliotibial band syndrome goes away. So isn't that interesting? Flexibility, of course, you want to keep your knee flexible. Your knee doesn't just bend and straighten, it also actually rotates. About the last 15 degrees of extension of you straightening your knee out, it actually has to rotate a little bit laterally. So that's a little accessory motion that you have full knee range of motion. So some stretches will take care of that. And lastly, a lot of people have never heard of this, but knee stability, they're calling it, increasing dynamic knee stability. Here they're talking about proprioception. Proprioception is your position sense. In other words, if we suddenly turn off the lights, you'd be able to tell me whether your knee was straight or bent without looking at it. And that's because of the proprioceptors in your knee giving you feedback, telling you where your knee is without looking. But they're finding that people with knee problems have problems with their proprioception. It's decreased. So there are some exercises you can do for that. But yeah, lots of things you can do. Nothing's quite as easy as slapping on a brace, though. Sometimes it doesn't give you that long-term carryover, which is why there's some other things I brought up you can do. But yeah, definitely, it's a good knee sleeve, so check it out.